What celebrity athletes know about PRP that maybe you should know too? Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical coming to you with this week's video. We're talking about platelet-rich plasma and how it just might make your life a little bit easier. Maybe a lot easier. Have you noticed athletes are staying in the game well into their 40s these days? Platelet-rich plasma may be to blame. Just two words. Tom Brady. Yeah, the 43-year-old is still competing at the very peak of professional football, having won the Super Bowl with the Tampa Bay Buccaneers recently. While Brady is the most notable of the older athletes that would have probably been retired had they been playing at their age just 10 years ago, maybe 5 years ago, well, he's certainly not the exception anymore. More and more athletes in their twilight years have found new life, and PRP is playing a part in it. Which begs the question, if PRP is keeping professional athletes in the game at that level, well, what can it do for the mere mortal like you and me that has joint pain? Well, let's talk about it. West Coast Orthopedics had this to say about platelet-rich plasma therapy. Quote, PRP is the new key to quick and full recovery. We are entering an age when doctors use biologic treatments such as platelet-rich plasma or PRP and stem cells to try to reverse the damage that these sports take on the bodies of the athletes. They add to this by saying, quote, the great thing about PRP is that this fairly new treatment may help patients avoid surgery altogether. It basically is a method where the knee, shoulder, or ankle can be healed from inside out. The actual process of the treatment doesn't take long, on average about 20 minutes or less. When platelets are activated in the body, they release healing proteins called growth factors. They have the ability to accelerate tissue repair and improve healing. Now, Precision Pain Care and Rehabilitation in Long Island, New York, they come right out and they say it real clearly. Prp Saves Careers. The Long Island, New York group says Kobe Bryant had to run to Germany to get his first PRP treatment. And his success and his raving about his success contributed heavily to PRP's skyrocketing popularity right now. In fact, he's the one who told Alex Rodriguez to get his PRP. Bryant is indeed the first evangelist for PRP in the USA. Now, researchers have proven the benefits of PRP for a lot of medical conditions, including things like tennis elbow, rotator cuff injuries, chronic plantar fasciitis, hamstring injuries, patellar tendonitis, knee arthritis, hip arthritis, in addition to it also has skin rejuvenation properties. In more recent years, scientists have proven its effectiveness in growing thinning hair back. It's absolutely amazing. They cite other athletes that have utilized PRP, which include Tiger Woods, Kobe Bryant, and Alex Rodriguez. Tiger and Alex used PRP to recover from surgery faster and stronger. There are suggestions that not only can PRP save careers, but may also save patients from having to undergo major surgeries like knee replacement or other potentially life-changing procedures. Our nurse practitioner here at Creekstone Integrated Medical, right here in Amarillo, can heal your joints with platelet-rich plasma. So briefly, here's how PRP works. We'll get a little technical here for you, just a sec, but I think it's really important to understand why and how it works. Most of your blood is made up of plasma. Your blood also contains a variety of solid components, red and white blood cells and platelets. The red blood cells transport oxygen and keep everything working right. The white blood cells are your immune system's knights in shining armor. They're warriors. The platelets clot your blood when you're cut or you're injured, so you can repair the damage. Platelets are full of multiple growth factors for wound healing, including growth factor and insulin-like growth factor. When our nurse practitioner prepares PRP from your blood, they create a platelet-concentrated form of plasma. Then the platelet-rich plasma is injected into the site of the injury. The dense concentration of platelets, about 5 times the normal concentration, that jumpstarts healing so that your body can quickly repair your injury and restore function. So why is PRP any better than other alternative treatments? Well, the best part about PRP is that it doesn't tear up your joints like cortisone injections do. And cortisone is the most popular joint injection out there, but the providers will only do a series of maybe 3 of them because they are detrimental to your joints and to the cartilage and even to the bones in the joints. PRP comes from the patient, so there's little to no real risk of a bad outcome. And in randomized controlled trials, PRP shows to be mostly more effective than cortisone or hyaluronic acid for many conditions. It's simply a no-brainer. So what about PRP for hair loss? Well, I mentioned PRP's use in reversing hair loss earlier. I'm not necessarily one to hold up a Kardashian as an example, but Kourtney Kardashian used PRP to reverse her hair loss in their TV series back in 2019, and this brought the treatment into the mainstream for hair loss. She went to her plastic surgeon who recommended platelet-rich plasma injections in order to stimulate her hair growth, but felt full regrowth would be possible. Basically, the PRP is injected into the scalp in order to repair damaged hair follicles and encourage fuller, thicker hair growth. And PRP can be used for male or female patients that are experiencing pattern baldness and hair loss, or just thinning. While some people are amazed at the results, it is reasonable to expect the hairline or the hair thickness a patient had around 5 years prior to undergoing the treatment. I know I had more hair 5 years ago, so it's something I'm probably going to be doing very soon. Female hair loss, it turns out, is actually very common. Common causes are stress from surgery, trauma, illness, weight loss, and things of that nature. Also, oral contraceptives and androgenic alopecia. Autoimmune disorders like lupus and alopecia areata may also be culprits. Then there is also what is called traction alopecia, which is caused by females having tight ponytails and braids. The research is outstanding for PRP for hair loss, y'all. It's commonly combined with other hair loss treatments like topical minoxidil. Now, speaking of Tom Brady, there's even suspicion that he's using PRP to maintain, as they put it, a glorious hairline. Now, rumors aside, I've got to say I've done my research. The research literature is outstanding, showing that PRP is safe for joints and more effective in most cases when helping these joints heal. Much safer and more effective in most cases than the other alternatives like cortisone and hyaluronic acid. Again, cortisone hurts the joints. PRP doesn't. PRP is helping save careers, and it's helping avoid surgery. If you're from the Amarillo area or you're going to be coming through and you need to be treated, call us at 806-355-3000. If you're watching us on YouTube, subscribe, comment, and share. For Facebook, like, comment, and share. That's the way of the social media world, and businesses like ours depend on your help and your sharing. We appreciate you. For Creekstone Integrated Medical, I'm Dr. Jeff Williams. Take care. We'll see you next week.